But here's the problem with addressing symptoms, right? You're not getting at causes. And if you're not getting at causes, you're not going to cure anything. All right? The cure is found with a two-step process that we'll talk about here a little bit later. Doctor means, from doctorus, teacher. And this was mentioned in one of the other lectures. Doctor means teacher. When you're seeking somebody out who's a so-called doctor, take a good look at them and say, what is this person going to teach me? Do I see truth when I speak to them, look at them, and watch them interact and how they live their life? Because if they ain't living it, they're probably not going to be teaching it too well. At least they're going to be able to teach you too well. Because obviously they still need to learn because they're not applying what they know. One of the quotes, it might have been Voltaire, the famous philosopher, but the true role of the physician is to simply entertain the patient until they get well on their own. Are all therapies bad? I don't know, let me consult the manual again. This is so great. Like I said the other day, I had a military guy. He's like, I have to get better now. I have the manual. And okay, here's how you're going to know whether all therapies are bad. If you're considering something, this is what you ask yourself, these significant 7 questions. To what extent is this therapy suppressing symptoms but leaving causes untouched? To what extent is this therapy providing additional symptoms, negative side effects, or other problems? To what extent does this therapy empower me with correct knowledge, a greater capacity for healthful living, improved well-being, and a better quality of life? To what extent does this therapy assist the body's self-healing mechanisms and utilize natural laws of healing to bring about optimal results? To what extent does this therapy promote dependency on someone else or something else to feel better? To what extent do the potential benefits of this therapy outweigh the potential risks? To what extent does this therapy impact one's resources of time, money, and energy, and who else may be benefiting from this therapy financially or in some other way? If it doesn't pass the 7-question test, I wouldn't participate in it. It's simple as that. Pretty straightforward. Step 1, remove the causes of the problem. Right? Pretty logical. For some people, it's straight up mechanical, and for some people, it's mental, emotional, and for some people, it's spiritual and metabolic as well. It just can be physiological. So it's one of those things. It's not always easy, but usually when I sit someone down to an assessment, I can usually figure it out. There's always a cause. And then establishing the conditions of health. So once the cause is removed, then you have to establish the conditions of health, which goes back to the continual health comes from healthful living, right? So you know how to establish the conditions now, if you've been attending these lectures and been here all week, or you'll have a better idea of how to do it, now you just have to do it. Therapy is a way of life. And as I teach a lifestyle, it's not something you get done to you, it's something you participate in, right? It's a lifestyle.